Hello, everybody. I want to thank you all for joining for our first ever live stream. Today, we're going to be talking about a very popular topic, in my opinion. I know that it's out there on social media. A lot of people wonder about it, especially postpartum. So we're going to be looking at diastasis recti or diastasis recti, however you want to say it. And we're going to be kind of going over some myths that I find, a lot of misinformation that I find out there. And so I just want to clear the air and make sure everybody's on the same page so that when you start looking to heal your diastasis, or if you're already in that process, you kind of start with the good information. And I don't want you to get scared over misinformation that is out there or that you potentially have come across. So in case you don't know, my name is Dr. Sigi Reyes, and I am the owner of Bump Fit Physical Therapy. And we see women during pregnancy and throughout their postpartum phase. So for today's topic, let's go ahead and get started with DR facts to begin with. So the first thing that I want you to be able to see is that the linea alba weakens and stretches over time. So what is that? The linea alba is a strong white connective tissue that is located midline on the abdomen. So basically that runs anywhere from the sternum all the way down to that pubic bone. And during pregnancy, it can stretch and widen as the abdominal muscles separate and accommodate the growing baby. And this is a normal physiological process. So there's nothing wrong with you, it happens. The second thing is that you can't necessarily avoid it, but you can definitely manage it. So everyone, again, at the end of the pregnancy is going to have a diastasis. And again, simply because you're making space for that baby as you progress through your pregnancy. And there's definitely things that affect it firsthand. A lot of things depend on how wide or how weak that tissue gets. Factors like how many pregnancies that you've had, how you're carrying, how much weight you're putting on, how old you are. Again, as we age, our tissue becomes a little bit more weaker. It's not as elastic as it once was. So certainly that affects the connective tissue as well. So if you're closer to your 40s than closer to early 20s, the tissue is definitely going to be a little bit different there. But the biggest factor is genetics. Genetics is going to play the biggest part in how severe a diastasis can be. So if your mother had it, if you've had hernias before, then this is all kind of like a predisposing factor of that you probably most likely will have a diastasis. And the other thing that you need to know about this, as far as being able to manage it, is it comes down to day-to-day things, whether that be breathing, whether that be posture, whether that be mindful in how you're doing your work, doing housework, if you already have little ones, how you're caring for them, how you're picking them up. So you can definitely manage that. And number three, know that 1 in 3 women have a diastasis at 1 year postpartum. So just because it's common doesn't mean that it's normal. When it comes to a diastasis, people always want to know, especially if I'm already seeing them, when can we test out for the diastasis? They're looking to get tested. And honestly, I don't like to test until you're closer to 8, 10, even 12 weeks postpartum, because that's going to give you a better reading of what that looks like versus earlier on. Things are still healing. Things are still not necessarily in the right place. There's still a lot of swelling, especially if you've had a cesarean. So all these things also take a part. And so the further out that we are, the better reading you're going to have versus closer and earlier on. After delivery, again, most people are going to have that diastasis anyways, so it's kind of pointless to check at that point. At that point. So many women are even unaware that they have a diastasis, even at 1 year postpartum. This can come from different things. It's not always a pain thing, and we're going to see about that a little bit later on. You can exacerbate your diastasis by doing the wrong exercises too soon. So maybe you didn't have a bigger diastasis earlier on, but the fact that maybe you jumped into heavy lifting or pull-ups or certain exercises, this may have, exacerbated things and made things a little bit wider. And now you're dealing with that diastasis when you're out postpartum. And finally, maybe you're not doing enough or anything to help that diastasis heal. Maybe it's a matter of, you're scared. You've heard this information out there. You've seen social media influencers kind of telling you what to look out for, and that's part of the reason I'm doing this. Myth busting is because I want to make sure that you get the best information out there, and you make the best decisions for yourself. So the first myth that we're going to be looking at is it's only a cosmetic issue. And that is myth number one. And the reason that is that while insurance primarily only looks at, billing and things like that, you can't always bill for separation of muscles, especially if there's not other symptoms like pain or things like that. But what I see is that we are more than just a billing. We are more about that, and it comes down to mental health. Several times I'll have women touch their diastasis so that they know what they're looking at, what they're feeling for. And a lot of them are very hesitant to even touch their midsection. They don't want to, put their hands there. They might try to suck in all the time to make themselves look better. They might feel they might have poor body image as well. And then they'll feel that they're broken. It's often our job as physical therapists to not only help you with the physical aspect, but also support your emotional needs. I've had several women get emotional and cry when they're starting to touch their midsections, whether it be from a C-section or from a severe diastasis. And this is often because we carry stress in our midsections, and especially if there was trauma, if we had, maybe a bad experience with delivery, this can also lead up to it. So one of the biggest things I like to do is I encourage people to journal through the progress of healing, because this helps a lot. Progress isn't always linear. Things happen. You might have a mental setback. Maybe you have a setback because you're traveling or your kids get sick or whatever the case may be. So it's, progress isn't always one way like this. It might go up and down as we continue to heal. So it can be discouraging for those if you're not always seeing this progress. So journaling how you're feeling, how your clothes fit, how you're feeling strong overall, being able to do certain activities that you weren't able to do prior also helps. I also like to let my patients know to take a picture. Take a before and after picture. I know it's scary initially to take that before photo. We can be so self-critical, but taking that before photo and then just tucking it away in your phone. And then later on, when you're, several weeks out, take another picture and compare the two. And I bet you that you will wow yourself on the progress that you've made if you've stayed consistent with the exercises. So the second myth that we're going to be looking at here is that core exercises are off limits. And that's simply not the case. So a simple Google search will tell you exercises like crunches and Pilates type exercises, planks, bicycles, leg lifts, all those things are off limits. And the truth is that at some point, you're going to need to begin implementing these exercises to make your core stronger. And DR healing is a healing balance of positive stress on that linea alba or that tissue that's in the midline, that gap to get it stronger while at the same time not stressing it too much and making it weaker. When treating a diastasis patient, I have them do a simple sit-up type exercise simply as part of their assessment. I want to see what happens at the midline. I want to see what their strategies are when they're trying to get up off the floor or get up in that sit-up position, or if they even have the strength to be able to do that. Oftentimes it's not about what exercises are off limits, but rather what exercises can I still do while maintaining good abdominal pressure. A healing journey might look a little bit like this. You might start with initial basic floor exercises, a lot of breathing, a lot of posture. Once you kind of get those down, we're starting to add weight and we're adding resistance, and we're gradually implementing core type exercises along the way with this. So, and then at the very end, you're doing the high impact or dynamic, demanding type exercises like a burpee. And that would be more on like the high end type of thing. But throughout the way, you are doing core type exercises and gradually implementing these along the way. The third myth that we're looking at here is the gap size does not always equal the healing time. So if you can look at our screen here, you can see that there's 3 different types of diastasis that we're looking at. Initially, you can see something that the opening is up higher. You can see one that the opening is lower. And then there's one where the opening is just kind of throughout the entire thing. We usually take 3 different measurements when we're looking for a diastasis. The first one is kind of what everybody knows is how wide is the diastasis. So that's basically putting your fingers between those 2 muscle bellies and seeing how many fingers you can stick in there. We say usually 2 and under is considered normal. And after that, you're going to be needing some type of PT. And then the second one that we're looking at is the depth. So how far deep does my fingers go down into the midsection while you're doing the exercises? Does it just stop at my fingernail bed? Does it keep going down past that first knuckle, second knuckle? Does it feel like it's never going to stop? And then the third one that we're looking at is the connective tissue integrity. So is it super soft and squishy, or does it feel a little firmer like a trampoline? So that's the 3 different things that we're looking at when we measure a diastasis. The other thing to take note of here is a lot of times when people are measuring their diastasis, they're measuring right at the belly button. But if you can look at the pictures here, you can see that you can have a diastasis up higher. And so if you're just measuring at the umbilicus or the belly button area, you're going to miss that you have a diastasis. So later on, when you're doing exercises, when you're dieting, and then you're saying, I'm stuck. Why am I not able to lose this weight? Why do I still look pregnant? Well, it could be that, you just simply missed measuring the correct area. So make sure that you're measuring all the way from the top of that breastbone right there at the very tip, all the way down to that pubic bone. In terms of function and health, studies have found that the integrity of the connective tissue between the muscles, or that linea alba, is believed to be more important than the size of the gap. So again, when the connective tissue is healthy and firm, this allows your core to function well and the appearance is flatter, even if you still have a gap between the muscles. So could that mean that women are focusing on the wrong measurement? Are we so focused on how wide is my diastasis? But in reality, we should be focusing on how deep is it? How firm is that gap between the muscles? I've had women on both ends of the spectrums where I can put both hands and then feel like I still need more fingers to put in there to get a true measurement, and then they kind of sink in forever. And then I've also had women on the other side where their gap is very small and narrow. But the difference is here that big wide gap can also be nice and firm and shallow, versus the narrow gap can also be very deep. So kind of looking at those 2 things. All right. Myth number 4 that we're looking at here is that, is ab separation causes low back pain and pelvic floor symptoms. So abdominal separation itself is painless, and it's not going to cause pain, but it can contribute to things like low back pain. It can contribute towards things like pelvic floor symptoms. And this is primarily due to weakness in the transverse abdominis. This can be due to postural changes and weakness. This can be to breathing patterns, especially during pregnancy, our breathing changes, and afterwards, it doesn't always go back to the way that we were breathing. And it most definitely can be due to past medical history. So if you were already dealing with back pain prior to your pregnancies, if you have already been diagnosed with maybe sciatica before or disc issues, then definitely the diastasis is not at fault. I have at least, if not more than a lot of my patients come in with simply just diastasis issues and nothing else. So they might have, even 4 or 5 finger width diastasis, and they're not dealing with pelvic floor issues. They're not dealing with back pain. And if it is a back pain, it's typically due because they're caring for an infant. So it's higher. It's upper back pain, mid back pain, because they're rounding forward and feeding their little one, and not so much because they're weak and they're having to hold themselves up. So one way we can look at it is, when we're thinking about a diastasis, we're thinking about it being like a canister, like a soda can. And this is also going to come into the next play for the second or the fifth myth here. But we're looking at, things being solid all the way around. And if there's weakness in that canister at any point, that can cause the symptoms. So if we're having weakness in the pelvic floor and there's too much pressure in that can, then the symptoms are going to be presented as leakage or prolapse. If you have weakness in the front of your stomach or that diastasis and there's too much pressure, then you're going to see that appearing there. So moving on to myth number 5 is that doming is bad. And this, again, goes kind of to what I was just talking about, of it being like a canister. So doming is our body's way of telling us how we are managing that intra-abdominal pressure. So I have this little soda can here just to kind of represent that. Doming, if you don't know what it is, if you were to lay back on your back on a firm surface and then try to do a sit-up, and if you notice that your midsection kind of just domes up, peaks up, it looks almost like a coning or a football, then that is called doming, and it can be either soft or firm. So we typically want to avoid firm abdominal doming, as this is telling us the activity that we're doing is causing more intra-abdominal pressure than we can handle. Soft doming, on the other hand, is typically deformation of the loose skin or fat or over-recruitment of the rectus abdominis muscles. So as far as that goes, you can have firm doming if you're sitting up and you're, earlier on in your postpartum journey, or you can also have that doming, that bad doming, that firm one, if you're trying to do something like a pull-up, then you can see that really popping up. But on the flip side, those two exercises on somebody else could be soft doming. So everybody is it's independent per person. As far as like the doming, it's not a one size fits all. And that's, usually what I preach is not one size fits all when it comes to rehab, and especially with like postpartum stuff. So I know that was a lot of information, but I know that it's never too late or too far past your pregnancy to address a diastasis. So we have gone ahead and covered all the 5 myths of diastasis that I typically see when I'm scrolling through social media, or people bring it up to me during appointments. They may say that they heard this, that, or the other. So these are the common ones that I've seen, and I'm glad that we're able to debunk these 5 common myths that I often hear. And I hope that this mini workshop gave you some valuable information on diastasis recti. So my goal is to pop in here a couple times a month to share some quick knowledge bombs on pregnancy and postpartum, things on getting back to exercise, running, pelvic pain, any type of those topics. And if you have a topic that you would like to see covered, maybe you're curious about it, then make sure that you leave your suggestion in the community page, because remember, if you're wondering about something, then chances are there's also somebody else out there that's wondering the same thing too. And we want this to be a community where people feel comfortable discussing these things amongst yourselves. And I will pop in there often to also comment on things. So don't be shy and make sure to comment. The other reason I like to hop in here is to allow you know a little bit more about what we do, who we are, and how we serve. So if your interest was piqued, if you're wondering if you need a little bit more or simply want to know more, then there's two ways that you can start working with us. We always start with a no strings attached chat to see if we can even help you. We want to do this to make sure that we are the best fit for you, that we can get you to the goals that you're looking for. So we can do this via email, we can do this by phone, or even text if that works best for you. And if we can't help, then we can decide together what course is best to take for you. So you may want to do more of a group program, an independent program, what's kind of self-led, more specific to diastasis or leakage, or maybe you have goals to increase your strength overall. Then we have programs for this. If you're more of someone who needs a little bit more guidance or accountability, customization, then you really want to support and check-ins with us, then we offer one-on-one work with that as well. So if you're looking for an independent program, you're going to go ahead and DM me the word core and we will get you on the right program. If you're looking for more one-on-one accountability and customization to reach your goals a little quicker, then DM me VIP if that sounds like something that you might want to explore. Otherwise, we are here in the group. We're here to support and reach out if you need anything, and never be afraid to message me if you have questions later on this, or if there's something else that you want to try out. And if you're catching this later on in the replay, let us know in the community tab. If this video was helpful, we want to hear your wins, we want to hear your gems, so we can continue to make these even better in the future.